So how do you know if you have a strain or a sprain?
It's about getting to the root problem.
Hey everyone, it's Dr. Heather, your virtual sports chiropractor, and I think that's a common question we actually don't always know the answer to is, how do we know the difference between a strained muscle versus a sprained ligament? And hopefully you just caught what I just said there. Strains usually are what we see with muscles, and sprains are what we see with ligaments. And it's very important to distinguish the two because the treatment can vary just slightly when we look at both. Now, strains for my runners, those areas would be most commonly known as your quads, that's the front part of your thigh, or the hamstring muscle, which is the back side of the leg. And when we look at sprains, the most common area is an ankle sprain. Now, the ankle sprain usually happens on the outside of the ankle just because there's a little bit more vulnerability when it comes to the three ankle ligaments that are down there that come off the fibula, the tibia, and attach to the talus and to the calcaneus bones. Now, I want to go through this with you guys a little bit more. Now, strains can happen usually due to some type of overuse injury, but a strain can actually lead to a sprain, meaning if you don't attend to the proper treatment protocol for a strain, you can overstrain the muscle so bad that you can start also creating a sprain to the ligaments that surround or attach to that muscle. So I want to give you guys a couple of examples. Pretty much years ago, I was helping a friend of mine doing some training, and we were doing the Boston build-up program for the marathon. We had horribly cold conditions out here in the Northeast where we had a very high wind chill factor, low temperatures, and when I went out to do the 10K run, my body wasn't warmed up enough. So naturally what happened was my muscle tore. My muscle really started to have a strain, and because I kept running on it, I actually did more harm because I started to tear the actual muscle. So I didn't stop immediately. I allowed that muscle to really kind of tear a little bit further. That's on me, guys, totally on me in terms of mistake made. But my whole point is that if I had listened to the body, the minute I could feel that strain, I could feel that pull in that muscle, and I stopped and I did some soft tissue work, I compressed the area, I really attended to it, I gave it some TLC, chances are I wouldn't have torn the muscle. Now, when we know we've done a sprain, the same kind of principle applies. Sprains can sometimes lead to more like stress fractures and other injuries because we're overloading an area and we're not allowing the body to kind of really heal itself a lot further. Now, like I said, a strain is focused on the muscle, and that's where we can really feel some overuse injuries kind of set in. And a lot of times if we haven't had proper hydration, nutrition to our muscles, we can strain them. We can really kind of do more harm than good. Now, when it comes to a sprain, if we go ahead and we don't address the fact that we're putting too much load or force on an area, the sprain can come a little bit more chronic and it can take a longer time for it to heal. But a sprain could actually lead to a further overuse injury and can lead to some other stuff as well in terms of compensating patterns where we start developing secondary injuries as well. Now, again, how would we address these things? Well, like I said, a sprain, when we look at the quads and the hamstrings, we want to go ahead and kind of treat it with massage, foam rolling. You could use a Theragun. You could go get a massage, which I always recommend because I love massages. You could also look at going ahead and doing some stretching, nice, easy, active, dynamic stretching before your workout and doing some nice passive stretching post-workout. And again, with the sprain, you want to go ahead and address everything within that first, onset up to the 72 hours where you're getting the ice on. You're really going ahead and you're paying attention to the swelling, maybe adding in some compression as well. And also too, if you haven't gone ahead and checked it out, check out my ankle sprain video where I give you guys actually a whole treatment protocol that you can do at home to really help you there. Now, if you also want more information on strains, check out my video where I really go through what a strain is and the 3 types of strains that you could have and what to expect there. Now guys, as always, if you found this video helpful, give it a like. And if you're unsure if you actually have a ligament sprain or a muscle strain, drop those comments down below. I'm happy to give you guys all some free advice and help you get back to the activity you love most. All right, everyone, this is Dr. Heather, your virtual sports chiropractor. I'll catch you in the next video.